We'll get started. Good morning, everyone. Thanks for tuning in on this beautiful Friday morning here in Wyoming County. We have with us today Kelly Dryja, the Director of Community Services of the Wyoming County Mental Health Department, Bridget Givens, the Director of Behavioral Health at the hospital, Kristen Fisher, the Assistant Director of Adult Services, and Alyssa Cutcliffe, a licensed massage therapist. And they're going to each talk to us a little bit about returning to work after the COVID-19 pandemic and mental health. This May is Mental Health Month, so this is a timely topic for this time of the year, but also for right now specifically. We have the chat room open so people can send their questions along, and they might be answered as we go, or we can look at them and also answer at the end. My name is Scott Gardner. I'm the president of the chamber. And now I'm going to just invite, I think Kelly Dryja is going to get us started and invite her to take over.
Oh, well, actually, Kristen's going to start, but we are excited to be able to have this opportunity to present to everybody today.
Yes, I can say ditto to Kelly. I'm so excited that you all are here today and you're willing to sit here on a beautiful Friday before a holiday weekend, sitting here with us for an hour or so and learning how to take care of yourselves and your employees. It really demonstrates your commitment to wellness and your commitment to everybody in your workplace. So thank you very much. So I'm going to start off today with a mindfulness exercise, actually. And Scott, if you wanted to bring up the next slide for me. Don't be worried about mindfulness being hard. It is not. One of those things, like everything else, you get a little bit better the more that you practice it. And what mindfulness is just a way to pay attention to where you are in the present moment. And it's especially useful right now when there's so much uncertainty and so many worries about the future. Bringing back to the present moment can help you reduce stress. It's a simple practice that you can do even at work when you're having a stressful day. It can help us improve our focus and help us be calmer and kinder to ourselves and one another. And for those of you who are in customer service, I mean, obviously that's what you want to do all day, every day, be kind to other people. So let's start with the mindfulness exercise. And we're going to start here by taking 3 deep breaths. So you can choose to participate or not, but in those of you who are, take 3 deep breaths for me. And we'll do that quietly to ourselves. Okay, and then, Scott, if you want to show our next slide so that everybody can follow along. The first thing we're going to do is look around and notice for yourself 5 things that you can see. And then after you found 5 things, how about 4 things that you can feel? Could be the chair that you're sitting in, how your clothing feels. Maybe you're drinking a cup of coffee or a cold beverage. And then 3 things that you can hear. So mental health department's right on Main Street, so I hear a lot of traffic. I hear birds. And then 2 things that you can smell right now. Hopefully good things. And finally, 1 positive thing about yourself. And when you're done, you can take 3 more slow, deep breaths. And hopefully feel calm and focused. I'm ready to talk about mental health and mental wellness. So if you enjoyed this exercise and you want to bring more of it into your life, a quick Google search will have a plethora of mindfulness activities that you can do. So if I could get the next slide. It's really important to emphasize everyone has mental health. A lot of times we confuse mental health with mental illness. What we like to say is that really mental health is just part of our overall wellness. So just like with our physical health, a lot of time, hopefully, we're feeling pretty happy and calm and productive and ready to take on the world. You know, so just like with our physical health, we have days where we're feeling strong and good and we can do whatever we need to do. Other times, you know, we may have a day or two where we're feeling kind of cruddy. Maybe our allergies are acting up or we have a headache. And that's the same thing with our mental health. We all have days that are more stressful than others, or we might feel a little bit sad or something happens that gets us angry. And we know that we need to take a little bit of extra care with ourselves. But those times, you know, they come and they go and we can move on and cope with them. We have other days maybe where maybe physically we might have a cold or come down with the flu or something a little bit more serious, and we know that we need to take extra special care with our health, or maybe even go to a doctor, take some medication. Same thing with our mental health. Others of us might have chronic conditions, asthma, diabetes, high blood pressure, that require a lot of extra monitoring, maybe some lifestyle changes, again, taking medication, you know, really having a relationship with our doctor. And that's the same thing with mental health. You know, some of us may have chronic conditions like depression or anxiety or other stressors that require a lot of extra monitoring. So mental health and mental illness doesn't have to be a big scary thing. You know, we think of it just like our physical health, and we really want to talk about it in a way that's just like as common as we talk about our physical health. And so when we talk about mental health and mental wellness, it's really what allows us to cope with stress, be productive, contribute to our communities, and realize our full potential. And that's pretty lofty, but when we have that mental health, when we have that ability to cope with things, you know, this is what we can do. We can do wonderful, great things. So even at work, we have mental health. A lot of times, you know, we think we go to work, we try our best to be pleasant and productive and professional. But I think that you know, and I know that some days we have days where we have other things that are going on in our lives, and it really makes it a little bit more difficult to be at work and, you know, be okay. And I think that, you know, all of us, if you think for a moment, have in your head, you know, you might have that one person at work that seems to struggle a little bit more emotionally than maybe somebody else does. And, you know, what are we thinking about that person? Are we, you know, resentful because maybe they don't work as hard as we do, you know, or do we, you know, doubt their commitment to their job? So, again, when we're thinking about work and we're thinking about our employees, remember that everyone has emotions and they don't go away just because they're at work. So what we really want to try to do is build a workplace in which everybody feels valued, everybody's supported, and where, you know, we're not thinking less about somebody just because they're struggling with their mental health today. So with my next slide, what I want everybody to do is just kind of check in with you all today. I wonder how you're feeling today. So if you want to just put a word or two in the chat box to describe how you're feeling right now at this very moment. Don't be shy. Somebody's tired. I hear that.
Should have prepared.
Ready for a long weekend for sure. Productive. Hey, that is fantastic. Valerie's feeling good. Awesome. Okay, we have some really productive people that are talking some smack, which is kind of enjoyable. Okay. So I agree that. So just know, you know, every time at work, you bring yourself with you, you bring your feelings with you. And, you know, it's really important as we return to work during all of this COVID mess that people are going to come to work with all kinds of feelings. And we just want to honor that and respect that. Cut everybody a little bit of slack, especially Joe and Jason. Cut yourself some slack today. So moving on, how I feel the silver lining of all this COVID-19 mess is that I think that we're more willing to allow one another to feel, you know, maybe the feelings that we don't talk about. You know, so kind of everybody right now is feeling all the uncomfortable feelings, you know, stress, sadness, uncertainty. We're all frustrated. We might be grieving a little bit. And I think that because we know that probably somebody else is feeling that way too, we're really more willing to have a conversation about these feelings. Suddenly it's okay to be not okay. And we're willing to support one another. So I really want to take these feelings and translate them into the workplace when we're able to go back to work. So I'm going to let Kelly right now talk a little bit about the brain and what's going on with the brain right now.
Thank you. So the brain is obviously very much connected to our mental health, and I wanted to give a little bit of information on that. Have you ever lost control of your emotions and did something in the heat of the moment that you later regretted? I think for me that happens, you know, occasionally. You blew up at somebody, or you know, like you just lost it. Maybe a driver in another vehicle as you're driving down the road, your partner, a child at home. And it was such an intense emotional reaction that it was out of proportion for the situation. And if you've had that experience, that's what we call an amygdala hijacking. So that's what's on your screen, an amygdala hijacking. So the amygdala is part of our brain, and it's designed to protect us from danger. Originally, you know, back a long time ago, it was, you know, it's protecting us from saber-toothed tiger attack or a bear attack, those kind of things for survival. But the way our brains work today, we still have that piece in our brain, even though that isn't the kind of you know, stress that we're going to experience. So what happens with our brain is that we sense something, we hear something, we we smell it, we touch things, and that sensory information sends in our head to our thalamus, which is in our brain. It's a relay station. So that thalamus relays the information to our neocortex, which is our thinking brain. That's the top part of the brain on that slide. And then from there, it sends it to the amygdala, which is our emotional brain. And that produces an appropriate emotional response that we're going to have. So if we're faced with a threatening situation, our thalamus sends sensory info to both the amygdala and the neocortex. But if the amygdala senses danger, it makes a split-second decision that it's going to initiate that flight or flight response, and before the neocortex, our thinking part of it, can overrule it. So when we work with kids, just as a side note, that we make a fist like this, and that the top part of the brain is that thinking piece, and the emotional brain is your thumb. And so when you have, you know, if you have an emotional outburst, you know, you flip your brain, that's what happens, and your emotional side takes over and is making your decisions for you. And what happens when you do that, that triggers the release of some stress hormones. So hormones like epinephrine, which is adrenaline, or cortisol, and these hormones are going to prepare your body for that fight or flight response. And what happens physically to your body is you're going to have an increase in your heart rate, elevates your blood pressure, and it gives you that boost of energy. We know, like we've seen, you know, like if somebody has, they've had superhuman strength in that moment to lift the car off of somebody, that's your brain responding with those hormones. So we know that our threats today that aren't the same as, in the past that required that quick response, but our bodies are programmed, our brains are programmed to still react that way. So with that, there are other ways that amygdala hijacking can occur, and that's through chronic stress and certain mental health conditions that people experience. So some people with post-traumatic stress disorder or anxiety show increased emotional responses, and that's all, through our brain. But even without a mental health diagnosis, chronic stress can lead to an overactive fear and anxiety circuit in the brain, and that reduces functioning in other areas of our brain. So, that if you live in that chronic stress, that area of chronic stress, that's just not good, and your body over time does create a different reaction to how you handle stuff around you. So I should point out though that we all have stress and in our lives, and that's a good thing because stress does push us sometimes to do things differently that we wouldn't normally do, to create change, take action. But chronic stress is that constant worry about whatever it is that is causing you that worry. It could be finances for people right now because they're out of work and they don't know how they're going to pay rent. They have to choose between paying for the electric bill or do I choose to buy food. That chronic stress triggers more frequent amygdala hijackings, so you might lash out more at others than you normally would. You might have problems with your short-term memory, decision-making, things like that are being impacted by what is going on around you. So, and there is reason for that. It does go back to what is happening in our brain. We're going to give more information as we go about some specific mental health challenges that people are experiencing right now, given what's going on around us. And we're going to discuss ways that we can work on improving our emotional reactions and coping mechanisms. And then we're going to finish off by sharing some resources of where you can get additional help if needed. So you'll know if that's your brain and how it's working. So next slide, Scott. Thanks. So like I said, it's normal. We're going to experience sadness and stress, and we want it, hopefully it can be proportional to the daily stressors that you have going on within your life. And things happen, you adjust to it, you go on and you go about your daily business. We also know that sadness is normal. It's a normal reaction, that loss. We know that a lot of people are grieving the loss of our normalness that we have right now. People can't celebrate graduations that they'd like to, just different life events. Funerals aren't the same. So that is a part of the normal reaction that people are having right now. And it's common. So in one study, this was prior to COVID, before the COVID outbreak, more than half of people surveyed reported feeling stress more than half of the time they were at work. So it really is just important, even prior to this, that people make sure that they know how to take care of their stress that they're experiencing. Another study by the Kaiser Family Foundation, a recent report they issued, said that the need for mental health and addiction services are undoubtedly going to increase because of the COVID outbreak. Factors such as social isolation, job loss, and income insecurity, burnout, and strain of our frontline workers have had significant impact on the increased numbers of individuals and families in treatment. So this data that they collected showed that 47% of individuals sheltering in place reported negative mental health effects resulting from worry or stress related to the coronavirus. And 54% of individuals with income insecurity or job loss reported negative mental health impacts, with a staggering 26% of those individuals reporting major negative impact on their mental health. And additionally, frontline healthcare workers are at higher risk for experiencing mental health effects, including depression and substance use due to the stress of extensive work hours, lack of PPE and necessary supplies, and the loss of patients during the epidemic. So we know that, we're going to see as we come out of I guess, our isolation and, reintegrate back into society, we expect to see an increase in people challenged and struggling with their mental health. And we want to make sure that people get the help that they need. So next slide, Scott. When we should be concerned. Again, everybody wants to make sure that they take care of it, but we know that if that stress and sadness is so intense and it interferes with our ability to carry out our daily lives, that's when it gets to a point where it could be a diagnosable mental illness. And it's impacting our activities of daily living. So, taking care of your, hygiene, getting out of bed in the morning, just those normal things that you would be able to do if you weren't impacted by those feelings. It gets in the way of attending work or school, going to work, and it impacts our relationships. So we kind of like to look at it, it really impacts your ability to live, laugh, and love. Or that last one is that if it lasts for a prolonged period of time, some feelings, if they just don't go away and they are persistent, that is cause for concern. And you need to seek some form of treatment for that. So, and now I'm going to turn it over to Bridget to talk more in depth about some of the mental health challenges that we are seeing.
So I want to talk a little bit about anxiety. Experiencing occasional anxiety is a normal part of life. Anxiety is one of the most common forms of mental illness. And research actually suggests that if you suffer from an anxiety disorder, you are more likely to have physical health issues as well. And anxiety disorders are among the most common in the United States, affecting about 40 million people each year. People who do suffer from anxiety disorders have intense, excessive, and persistent worry and fear about everyday situations. It's usually characterized by apprehension or unexplained thoughts of impending doom, that something bad is going to happen. Next slide, Scott. So some common symptoms of anxiety are feeling restless and irritable. You have difficulty concentrating. You can have muscle pain, tightness, or soreness, trouble falling asleep or staying awake. You feel exhausted after even getting a full night's sleep. You're going out of your way to try to avoid situations that might make you feel anxious. And you could have intrusive thoughts, which are unwanted thoughts or worries that just won't go away. Moving on to depression. Depression actually ranks among the top 3 workplace issues in the United States. According to the World Health Organization, depression can cost more than $50 billion annually worldwide in loss of productivity and missed time at work. It is the leading cause of disability worldwide. Some common symptoms of depression include feeling or appearing low, empty inside, or irritable most of the day, every day. You can lose interest in activities that you would normally enjoy. Any change in appetite or weight, eating more or less, gaining or losing weight. Changes in sleep, either not being able to sleep or sleeping too much. Changes in activity, feeling restless inside or sluggish. You can feel exhausted even when you seem to have gotten a full night's sleep. Speaking or moving slowly, fidgeting or pacing. Feelings of worthlessness, guilt, along with hopelessness, that things are hopeless for you and that things will not get better. Difficulty thinking, concentrating, and making decisions, and even thoughts of death or suicide. I wanted to talk a little bit about substance use. So many people who use alcohol or other drugs do so to cope with stress or uncomfortable emotions or feelings. Our current situation with COVID can magnify these stressors, which can act as a trigger for certain people. Some of the resources which keep people in recovery on track, which is having a routine, staying busy, maintaining a good work-life balance, they're just not available right now like they were. Next slide. Okay. So this is a good reference, a good self-checker to ask, when might substance use be a problem? So over to the left, you see at-risk drinking begins when a person exceeds the low-risk drinking limits. For men, drinking 4 or more drinks a day or drinking more than 14 a week would be considered high risk. For women, drinking more than 3 drinks per day or more than 7 drinks a week would be considered high risk. And 65 and above, it's recommended that you do not consume more than 3 drinks a day. Next slide, please. This is also an effective tool, how you can tell if substance use is becoming a problem for you yourself or anybody that you care about. If a person is starting to give up or reduce important activities, social, occupational, recreational, because of the substance use, drinking or other drug use. If a lot of time is spent getting the substance, using it, and then recovering from its effects. If the person continues using the substance despite knowing that it has negative consequences, multiple DWIs, physical injuries, fights, those would be some examples of negative consequences. The use of larger amounts over longer periods than intended, problems cutting down or controlling the use, tolerance for the substance has built up, and problems with withdrawal. And some withdrawal symptoms that you might see are racing heart and elevated blood pressure. You could become sweaty, and some people even experience delusions and hallucinations with withdrawal symptoms when they stop using alcohol and or other drugs.
I know we do know that we are seeing, I think, Bridget, from your take at the hospital, an increase in people using substances, right, and presenting at the hospital for concerns. So we do know that is happening within the county right now. So I don't know if you want to share any on that, or if you're...
Sorry, Kelly, I had some background noise. I missed the question.
Just that we know that there has been an increase with presentations at the hospital with people struggling with anxiety and depression and some alcohol use. So it is a concern that we know that we need to be on the outlook for, that people are experiencing that.
We have seen an increase, an uptick in our individuals that are coming to the emergency department for mental health reasons, but they're also using a lot of alcohol. So we have seen that increase with assessments and individuals coming in, either on their own, families are bringing them in, or the police are getting involved because of situations that are taking place when they're intoxicated. So with the whole COVID situation right now, that has been definitely a factor that we have seen an uptick in at the ER.
I think we know that it is a coping skill that people use. So we are going to transition. How do we take care of ourselves?
Yeah. So
right.
Moving on, how can we take care of ourselves? So just like with our physical health, there's things that we do every day to make sure that we stay healthy, especially now. We're sanitizing our hands a lot more, we're wearing face masks, we're washing our hands, doing that physical distancing. And of course, there might be other things that we can do for ourselves, for our physical health, that don't require us to, seek professional help, so to speak. If you have a headache, if I have a headache, I take some ibuprofen, or, I might drink some water if I'm feeling a little dehydrated or thirsty. There's other of us who take a lot of vitamins just to make sure that we stay well. We do the essential oil thing. So lots of different practices that we do for our physical health that don't require us to seek outside professional help. So, mental health practices are the same way. There's lots of things that we can do for ourselves every day that, we just to take care of ourselves, to make sure that we are in a good place to face those life challenges that we have. So I wanted to ask you guys to use the chat box and take a moment. What do you do for yourself every day that helps you de-stress and feel good? While you're typing, I can share some of mine. You know, I like to go for runs, get outside. I like reading. Oh, Brenda, you and your daughter walk a lot. That is awesome. I love it. I enjoy having a cup of tea before bed. You know, hanging out with my kid.
I like to do gardening.
Kelly likes to garden. Bridget, what are you doing for self-care?
I like to go hiking, and I also run, spend time with my kids. And I also like to take car rides by myself.
Okay, yeah, sometimes, especially now that, you know, alone time is kind of key, definitely. So, oh, here we go, gardening and reading, very nice. Okay. So feel free to keep sharing your self-care practices, and I'll just move on with how are we taking care of our mental health. So, all right. So the first thing you can do is track your moods. You can do it in a journal, just kind of write down how you're feeling. There are lots of apps out there nowadays that have mood trackers kind of embedded in them. One that I want to highlight is called My Strength. And this is something that's actually free for any Wyoming County resident. So it's got a mood tracker on it so you can see how you're feeling every day. It's also got a lot of good resources and activities that you can do, anywhere from, you know, coping with depression to recovering from substance use disorders. So I encourage you guys to check that out. If you pay attention to how you're feeling, you can usually see patterns and, you know, learn what's going to affect your mood, and then you can kind of better plan how you can cope with some uncomfortable emotions. So speaking of coping skills, thinking about what helps and what doesn't, long-term, short-term, you know, we just got done talking a lot about substance use, which, let's be honest, can be real great in the short term, long-term can cause a lot of problems. So whereas something like exercise maybe could be, you know, maybe not so fun in the short term, but okay, really good for us long term. Again, try paying attention to how your thoughts affect your feelings and your behavior. Pay special attention to what you're saying to yourself, you know, that negative self-talk, and try and shift that. Talk to yourself maybe like you would a good friend. If you have a compassionate relationship with your friend and you don't have one of those relationships where you're just kind of talking smack to each other, but, you know, say nice things to yourself and notice some things that you can change, and start by changing something small to see if that can improve your mood. Scott, next slide, please. And these are what I call the boring self-care things, you know, things that you know you should do, and maybe, you know, not everybody is good at doing them all the time. I know I certainly am not, because, you know, again, short-term, long-term, ice cream is more delicious in the short term than a bowl of broccoli, but we know that our body needs good fuel to work optimally, and our brain does as well. Exercise is really an amazing thing that we can do if we're feeling low. Again, trying to get proper sleep, doing the best that you can to, you know, limit caffeine before bedtime, making your bedroom a quiet, cool, dark, cave-like place where you can go and get nice sleep. And again, sleep is so important that if you find that doing, you know, you do these things, it still doesn't work, might be time to talk to your primary doctor or somebody who might help you suggest better techniques for better sleep. Finally, again, you know, give yourself permission, especially now and especially as you return to work, you know, taking on those additional stressors, you know, just take a minute and do something that you like. And I believe, next slide, actually. Talk to somebody, make sure it's somebody that you trust. Doesn't have to be a professional, can just be a friend. Remind yourself, again, especially now, you're not alone if you don't feel super great every single day. There's plenty of forums and other articles online that we can read about people who've been through similar challenges. becoming aware of your breath, slowing it down, taking a couple deep breaths is really good for you. And again, like we did at the beginning, just practice mindfulness. Try and notice what's going on around you without judgment can really help take you out of whatever stresses you have going on in your mind and back to the present moment. So speaking about taking care of yourself, I want to hand it over to Alyssa, who's going to talk about some self-care tips.
Hey guys. So I'm a licensed massage therapist in the community, and I've had a lot of clients just reaching out to me because my practice is closed right now, and a lot of them crave that sense of touch. A lot of them crave that that interaction with people, you know, that they don't get on a daily basis. So they're contacting me, and my sessions with them have turned into more of Zoom calls or FaceTimes, text messages, or even just voice calls because they just want to talk. And that's okay. I am definitely not a mental health counselor by any means, but typically during my session, as my clients get more comfortable with me, they tend to talk to me and, you know, tell me things and ask advice. And that's something that I think they're really missing, is those private sessions. And they're also missing, you know, the time at the gym where they can run, you know, with their friend freely a couple nights a week and talk about, you know, how stressful their week was with their kids or something like that. So that's been really tough for them. But one thing that I notice in my practice pretty often is that the brain and the body are all connected. So typically a lot of people that I see don't realize that they have chronic fatigue issues because of their mental health. And I think that people are developing more of that as this COVID situation has continued. They're starting to realize that, you know, because they're not getting outside, because they're not exercising, because they're not getting proper care, they're developing these chronic fatigue situations, which are actually becoming worse. And then they also have depression and anxiety that they may have been on a lower level, and now is becoming a little bit worse with the COVID situation. So speaking of depression and anxiety disorders, more than 45 million Americans, actually almost 20% of the population, have some type of mental illness. And I think something for employers to notice is that about 57% of those people don't actually receive treatment at all. They either cope on their own, and sometimes they do fine, you know, whether it's seeing a massage therapist or, you know, some other type of coping mechanism that they have, or sometimes those people really are slowly spiraling out of control. So while you're home, some of the things that I suggest to clients is, you know, staying in a routine. I think for the first couple of weeks that I was in quarantine, I was thinking about the fact that, you know, I had completely changed my routine. I just stopped everything and was doing everything differently. So probably about 2 weeks in, decided, okay, I need to get back to my normal routine. I need to get up at the same time that I normally get up. I need to, you know, go take a shower, eat breakfast at the same time. And it's really helped me to maintain that sense of normalcy. And I think that's something that people definitely need to keep track of, is their routines. We spoke a little bit earlier about diet and exercise, hydration. I know being at home and being busy and doing things, sometimes you lose track of those things that you typically would be doing throughout the day. So still continue to, if you have the time and availability to, you know, nourish your body with good food, make sure you're hydrating, make sure you're doing things to help keep your body and your brain healthy, so that when you return to work, it's not such a shell shock when you get back. Another thing I wanted to talk about is limiting your screen time a little bit. I know quite a few of my clients have migraine headaches, and they've been asking me about what they can do at home to work on that, and I've given them some stretches and some other things that they can do. But limiting your screen time and realizing that, you know, you may be working from home, you may be spending a little bit more time on your cell phone, on your computer, and that's typically affecting your brain, your cortisol, your dopamine levels, and it's also affecting your muscles as well. So getting up, stretching, taking a little walk, taking a break, just for your own clarity is very important. And then I often suggest that, you know, making sure that they're sitting for a quiet moment and taking a deep breath and actually, you know, having something to look forward to, like a cup of coffee in the morning, or sitting alone at night, or that drive in your car while you're alone for a second, and you can just take a deep breath and take the day in and kind of just relax and let yourself unwind, because you still, even though you're home, you still need that time to unwind and let go of what's happened from the day. And that might be something that people are losing, not having the drive to work or the drive home. So taking time for yourself to do that is very important. And the last thing, as far as touch goes, I know a lot of people just crave that, and whether you're home by yourself or you have a significant other, reflexology points on your hands and your feet. If you actually Google that, or I'll try to send Scott a slide or something that correlates with reflexology points. Those are things that you can actually do on your own with a tennis ball, or even with your hands. Pressing on those specific points for significant amounts of time and following the reflexology guide will actually help reduce pain in organs, in body systems, and it will also help with migraines, anxiety, depression, and several other mental health illnesses that people are having. So just a non-medication way to help yourself, you know, release that anxiety and depression at home while you don't have any touch available. So I think that's it for me for anything that you can do at home, but I think Scott's going to post our contact information. So if anybody has any questions, I'm more than willing to help, and feel free to reach out.
Thank you. So lastly, I just want to remind everybody that we're going to talk about how to take care of your employees or your other people in your life here in just a minute, but really make sure that you're taking care of yourself first. So it's becoming almost a cliche right now that, you know, that old adage about how you have to put your oxygen mask on before you put the oxygen mask on your child or your loved one. If you're not taking care of yourself and doing things that support your well-being, you're not going to be able to take care of anybody else in your life. So it's really important to put some of these practices into place for yourself. So now I'll let Kelly talk about how to take care of your employees.
Okay. So we are going, Scott, you can go to the next. We're going to have one more chat box that people can type in their successes that they've had for their employees taking care of their health. I think one thing I guess I want to point out just overall in this is that everybody's response is going to be different. Some people aren't going to be affected at all from all of this that's going on, because their experience is different than others who might end up developing some form of mental health challenge or PTSD or something from it. We don't know. But it is all normal reactions to an abnormal experience that we're experiencing right now, and that, you know, each person's individual experience is what it is, and we just want to make sure that people get help if they do need it. So don't know, I'm not monitoring the chat. I don't know
Yeah.
if anybody chatted in anything. But
Everybody's quiet,
yeah,
and that's
no
okay.
chatting. Okay. We wanted to give Bridget a moment to talk about the hospital, just what they're doing there for their employees, and then I can talk about what we're doing here at the health department.
Sure. So at the hospital, we have a really great EAP program, Employee Assistance Program. It's promoted throughout our facility. And just recently, they sent out a newsletter that they're now offering telehealth through that program, which is awesome. We also do debriefings. So if there's any type of event, stressful situation, or code that happens at the hospital, there's a debriefing that takes place with the staff that were involved. And that debriefing doesn't just involve the facts and the details of the situation itself, but it also we want to touch upon how the employees felt when they went through it, how they feel afterwards. So it's sort of a de-escalation for the employees that have gone through something pretty stressful. We have a really great employee enhancement program here at the hospital, and that is a group of people, a committee that plan fun events for the staff, appreciation, lunches, picnics, recognitions, and every department has their own unit-specific things that they do. In the area that I work, I as a manager have always had an open door policy. So my door is always open to the employees. If they're struggling with anything, not even work related, if they're struggling with anything at home, they know that they can come and talk to me. When I'm not at work, I have a cell phone that they call, text me on, and I'm happy to meet with them, talk to them about anything that they might be struggling with. We have regular supervision meetings. We also do self-care lunches, and my ultimate favorite is our self-care ice cream. So we order out from Yummies and have it delivered. We don't group in large groups to enjoy the lunches or the ice cream, but two or three at a time. And it's nice for the employees, and it's a nice gesture for all of us to get together and do that. It helps. So those are some things that the hospital does, and unit specific what we do in behavioral health.
And Valerie shared during the remote staff meetings, they do different exercises, such as ask them about summer plans, tell about one good thing they saw today, etc. It helps to raise the spirits. I was going to share that that's one. We at the mental health department here are very light staff. We only have a couple people. Everybody else is working from home, so we try to have regular Zoom staff meetings, and it just allows everybody to still, stay connected, visually see each other, and just talk about what's going on, what they're struggling with, challenges, what's good that's going on, and that has been helpful. Pre-COVID, I think we are pretty good at trying to do at least monthly, maybe not so every month, but some kind of gathering of the staff with, a lunch. We either all order out and bring it in. We've done Croctoberfest in October, where everybody brings something in the crock pot, or we'll pick, a theme, salad, and everybody brings in something for a salad. And I think also have open door policy where people can come and talk if they need about things that are going on, same as it happens at the hospital. I think just a lot of, we each seek each other out for support when needed, because we encourage talking about mental health. So I think because it is kind of, second nature of what we're doing here. So I realize for some businesses that isn't, it doesn't just come so naturally. So some additional, if you want to go to the next slide, Scott. Some other things that we encourage that you can institute. And again, I think it depends on each business or what your entity is, of what you feel comfortable instituting and what's doable. And I think some of our suggestions, we did notice that you might have to modify them because of social distancing and masks and things right now. But, it doesn't mean that going forward, when we move out of that expectation, that you can institute different things. But we encourage taking your break, because getting away from the work is good. It improves your mood, helps you increase focus on what you're doing. So really encouraging employees to do that. Taking notice, take a scan of all your employees and know what their baseline is, and that so that you can notice if they're off, and encourage them to take a short break or a moment to get away if something is going on, is something that you can do. And then the last item I think is really important, and it's really challenging, I think, now during this time, is trying to have that work-life balance. If you're working from home, I think that is really challenging. How do you have that work-life balance? I think for both Kristen and I, that we, like, it's, when are you working? When are you, at the end of the day, are you still going on and checking your email, seeing what's happening? And because people are working from home, it's really hard to maintain that. But trying to have some, if you talk about having your routine, trying to stick to, if it's after 5 and you've put in your hours, then no, you don't go on and check work email or take phone calls, because that is going to promote your mental and physical health, and just take care of yourself. And then that allows you to focus on your family or other activities that you enjoy. That's when you should be doing that stuff, if you have that ability. I think it depends, again, on what industry you're in and what your work is that you're doing. Next slide. You want to encourage mental wellness. We're hoping that this is an opportunity that people are going to feel more comfortable to talk about how you're doing emotionally. So know what's available within your community. We do have resources. We're going to go over some slides, but there is help available. And we're always willing as a resource here at the mental health department, that if you don't know what's out there, but you have somebody that needs a specific service, we can help try to direct you to that place if it's needed. Also, you want to have that information available within your workplace, because maybe somebody doesn't feel comfortable coming to you and talking about it, but if it is just available and somebody can take that, that's a good thing. So that's another way that you can help encourage that. If you don't have an employee assistance program, it's something that you could think about getting, or if you do have one, promote it and make sure that people know about it. Next slide. We talked a lot about this already, just that I think it's having that social connection for people. So it shows, research shows that employment-related stress is highest among those that feel isolated at work. So having an open door policy, letting people come and talk to you if that's an option, that's something good to institute. If you have meetings, have it be, I noticed, I think with the transition to cell phones, we have a lot of, before a meeting starts, everybody's sitting, quietly looking at their phones, emails, whatever. And I think that has decreased just connectedness among staff, employees, and even, just that's an opportunity, put the phone down and ask somebody how was their weekend, or make it a part of the staff meeting. I know here at the mental health department, we try to institute or instill some sort of, it could be a craft, an exercise, an icebreaker, just so that it helps to just let people get to know each other, and it creates an atmosphere of I guess, fun within the workday. So, it's 5 minutes that's given to that, and that helps boost morale and just relationship amongst people. And it says to plan, this is the one I think that's a little challenging right now, but the pressure-free opportunities to connect. So I know, like, eating lunch together, but if, social distancing and all of that doesn't allow that for now, it's not something that you can do, but in the future, it is a good way to encourage connectedness. So, and that last blurb there is positive relationships and employers and coworkers is the top reason people feel satisfied at work. A lot of times you'll hear, they might not necessarily love the work, but they love the coworkers and they love the atmosphere. And so really trying to build that can increase the likelihood that an employee sticks around and wants to continue to work there, so you don't have staff turnover. And I think another thing that I just wanted to mention, I guess it's the next slide. Next slide. is the checking in. So how do you check in with somebody? I think it isn't necessarily, I think because of that stigma, like how is your mental health, that wording it, just how are you doing, open-ended, giving somebody the opportunity to talk about that. How are you holding up emotionally? I know within the county, we have, when there's I think that county response line that is available. We asked for the callers of that, the people who are answering the phones, to ask the callers, how are you doing emotionally? Because they might be calling in for food or some sort of physical need, but we felt that it was important just to check in on people's emotion. And I don't think that's where people go to automatically to think that they could use help for that, or that, that they should be paying attention to that. So that was something that we felt was important to make sure that we're asking others, how are they doing? You want to actively listen with your complete attention to what they're saying. Sometimes that's hard. You have work that you need to be doing, or you're distracted, but helping them feel that you truly care about their response is important. You want to resist the urge to think about how you're going to respond. Again, that goes back to really hearing what they have to say. Because if you're thinking about how you're going to respond, then you aren't really paying attention to what they have to say. And you want to avoid offering advice. Sometimes people just need to be heard. It isn't about, telling them what you think they should do, or, that they just want to express what it is that they're feeling. And, recognize it and reflect back to them that you understand what they're saying. And don't be afraid to relate on a personal level, and just let employees know that their feelings are normal, help is available, that you're there for support. And I think that goes a long way, just giving them reassurance that they're, that it's okay to share that, and then what they're experiencing is normal. Because I think everybody is going through this. And practicing what you preach. Model. You want to model good self-care. If you're stressed and not taking care of yourself, and that doesn't send the message to them that they should be taking care of themselves as well. So I think, is there anything else you want to add there? No. Did anybody else chat in anything else? I don't think so. It popped up. So we're going to go to the next slide of where to find help, what is available. This is just a small sample of what is available here in the county. We have a 24/7 crisis line. That number is actually good for Genesee and Orleans County as well. It's a tri-county crisis line, but ours is answered by Spectrum Health and Human Services. Someone would gather your information and direct you to the right situation if you were to call that crisis line. The behavioral health unit, which is where Bridget is from, I think we are lucky within the community to have it, because not all communities have inpatient behavioral health units, but there's a 12-bed adult inpatient unit here at our hospital. And the emergency department also has the ability to do psychological evaluations on people to see if they meet criteria to be admitted to the hospital. They do also have the ability to see adolescents for that evaluation. They can't admit an adolescent because the unit doesn't serve adolescents, but they would work on finding a bed available if somebody needed that level of care for an inpatient hospitalization. Not everybody needs that level. The Spectrum and Clarity are two options for clinics here within the community. They're both located in Warsaw, but Spectrum also has locations in Springville and Erie County Way, and Clarity also has a location in Arcade. They are functioning right now. It is mostly telemental health, so either by phone or through video, but they can see people for mental health treatment, adults and children. Spectrum also is our substance use provider, so they're able to do chemical dependency treatment as well as the mental health treatment, and both have the ability with psychiatric care to prescribe medication management services as well. I like to highlight New York FarmNet because Wyoming County has a lot of dairy and agricultural, our farms. That FarmNet is a 24/7 line that you can call into, but it's a free and confidential service where you get matched with a personal consultant and a financial consultant, and they come out to the farm to work with the farmers on their farm with whatever it is that's presenting the issue. You know, if it's related to financial, they'll focus on that, but usually they find that you know, there's communication things going on, or there could be depression, anxiety, chronic stress is something that, you know, they're experiencing a lot of, and so that can be a service that is helpful to farmers. Like I said, this is just a small choice of services. We do have a lot of private therapists within the community that somebody could choose to go and see a private therapist, and there are different other services as well. But these are the most commonly, I guess, used ones that I'd like to promote. Next slide. There is our info for the mental health department. So if you need some other type of service, but you're not quite sure, you know, you could reach out to us. You could also learn, if just in general, about how to support your employees, loved ones, friends. We offer mental health first aid and youth mental health first aid. They just give some more in-depth information about mental health and how to respond to that. And then also suicide prevention. We do, unfortunately, Wyoming County has a high suicide rate, and so we are always trying to look at ways of how to decrease that. How do we make sure that people get access to services that they need? One of that is Kristen offers a Talk Saves Lives training. She goes out to different departments, different businesses within the community, and she does, it's an hour-long presentation on suicide prevention, recognizing the risk factors, and how do you respond to suicide. So those are some things that you know, come out from here from our department that we could offer. And next slide. And oh, I think we didn't know if there would be any questions. That is all of our information.
Well, thanks, Kelly. I want to jump in there because I don't want to leave you hanging. I'm gonna stop the slideshow now, and we'll put everybody's pictures up here on the screen. And if there's any questions, people are more than welcome to put them in the group chat, and we'll give everybody a second or two if they want to do that. I gotta switch it over to everyone in meeting again too. And so we'll give a second there. While we're waiting, I just wanted to thank Kelly, Bridget, Kristen, and Alyssa for taking the time out today and presenting this information to everyone that attended. I will put it up on YouTube so that anyone that didn't will have a chance to also watch it. If it's okay, I will turn your PowerPoint presentation into a PDF and send it out to everyone that attended as well. And that has all those phone numbers already in it, so we don't need to send them out separately, so people can use it almost as a guide. I think that'll be helpful. I think you gave, again, some good information all around for individuals, employers, and employees. So I don't see any questions popping up. It must be you were so thorough that there aren't any left, which is fine. And maybe people, if they do, they can always obviously call you at the numbers in the show or in the slideshow and ask anything they have to, or send an email and we can get a question answered. So I guess with that, I just thank you again. And Kelly, did you have something?
We don't have our emails on there, so you can feel free to share the email piece of it if they want, and then you know, that is an option.
Oh, okay.
All right. A question for Alyssa, if she's still on.
Yep.
I was just wondering if she's heard anything about reopening or what phase she may be in for massage therapy. She's
in phase 2, I believe, right?
Okay.
Yeah, I don't know if she's there somewhere, but it's a personal services, we are making the assumption based on the information that we have received thus far that they would be listed in phase 2. So actually, hopefully fairly soon, in a week or so, which would be really good because we know that the massage therapists want to get back to work, and their clients need their services. You know, it's not just about relaxation, but it's a medical necessity in many cases. So
Great.
we want to get them back to work too. Any other questions that we can answer? Or? Okay. Well, very good then. Thank you, ladies, for being here and taking the time and putting the program together. And, you know, maybe we can do something like this in the future on some topics that are.
We would be
Thank
willing.
you.
Yep. Thank you.
Have a good weekend, everybody.
Thanks. You too.
Bye.
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 Bye-bye.